And the U.S. has now confirmed two confirmed cases of Ebola. The latest is a Dallas nurse who is the first person known to be infected on U.S. soil.
11 News reporter George Lettuce is live at Johns Hopkins University, the site of a major symposium tomorrow on this topic. Right, George?
Well, yeah, Stan and Donna, the number of Ebola scares far outnumbers the number of diagnosed cases in the U.S. So in light of all this, Johns Hopkins University quickly gathered a panel of experts to help us analyze what's next and how the U.S. has responded.
Pull it over.
There were more Ebola scares across the U.S. today. Sick passengers on planes in Nashville and Boston caused the scene. The new scares come as there's a new confirmed case in the U.S. A 26-year-old nurse at Texas Presbyterian Hospital who was caring for the man who died of Ebola last week becomes the first case of person-to-person transmission in the U.S.
We have to rethink the way we address Ebola infection control because even a single infection is unacceptable.
The Centers for Disease Control and Prevention say the nurse, who was wearing protective gear, got it from a breakdown in safety protocol. Exactly what happened is not clear.
Protection from an infectious disease requires the appropriate gear, but it also requires training, and it also requires experience.
Johns Hopkins University professor Dr. Andrew Picos will moderate a symposium at the university's Bloomberg School of Public Health on Tuesday, featuring a panel of experts who will analyze the Ebola response in the U.S. and new possible treatments and vaccines. The featured speaker is infectious disease expert Dr. Michael Osterholm, who has made headlines recently for his outspoken concern about Ebola. His op-ed in the New York Times presents a scary thought, quote, one that virologists are loath to discuss openly but are definitely considering in private, that an Ebola virus could mutate to become transmissible through the air.
The public is rightfully afraid of these kind of things, but what we're trying to do is really put it into context.
And meanwhile, we've learned there was an Ebola scare in Maryland tonight. Holy Cross Hospital in Montgomery County says a man went to its Germantown facility with aches and a fever. The hospital says the man had recently traveled to Africa. He was checked out by the hospital and was released because he did not show signs of Ebola. We're live in East Baltimore. George Lettuce, WBAL TV 11 News.